In this video we'll learn about loading dose and maintenance dose. So first let's talk about loading dose. The first question comes to our mind is what is meant by loading dose. It is the dose of a drug administered to quickly achieve the desired plasma concentrations, that is therapeutic levels. You may wonder what's the actual purpose of calculating loading dose. So it is used to achieve steady state concentration faster, especially for those drugs with longer half-lives. Now it is important to note that volume of distribution, one of the important pharmacokinetic parameter. To recall what volume of distribution is, it's the amount of drug distribution from the bloodstream into the tissues. Formula for calculating loading dose is the product of desired plasma concentration and volume of distribution to the bioavailability of oral drugs, where C target is the desired plasma concentration, VD is volume of distribution, F is bioavailability of oral drugs. It can be better explained with an example. Let's consider the drug digoxin. Digoxin has large volume of distribution, so it requires a larger loading dose to reach therapeutic plasma levels quickly. Moving on towards the maintenance dose. From the name itself it can be understood that it maintains. Maintenance dose. It is the dose of a drug administered to maintain a steady state of drug in the body. You may wonder what's the purpose of maintenance dose. To replace the drug lost during metabolism and excretion. Rate in equals rate out. To keep drugs level stable over time. For maintenance dose, the important pharmacokinetic parameter is clearance. To recall what clearance is, it is the volume of plasma completely cleared off drug per unit time. The formula for calculating maintenance dose is: maintenance dose is the product of C target, clearance and dosing interval to the bioavailability, where C target equals target concentration, CL equals clearance, tau equals dosing interval, F equals bioavailability. Let's understand with an example. Digoxin. If a patient has renal impairment, clearance will be reduced and hence the maintenance dose. It means if a drug is not cleared off completely, then the dose required to maintain the drug levels will also be less. Thanks for watching. Follow Mastering Meds for much such easy concept videos.